Well, for more on this, let's turn to Devra Davis. She's an epidemiologist advising governments and policymakers. She's also the founder and president of the non-profit Environmental Health Trust. Welcome to the show.
Nice to be back with you.
Wonderful. So let's start with your reaction to this WHO approval of China's Sinopharm vaccine. How significant is it in the global effort to end the pandemic?
It's very significant, but it also poses a problem for China.
And why is that?
Well, because China right now does not have enough vaccines for its own people, and they haven't adequately vaccinated in China itself. So that's going to be a problem in terms of production. I'm sure it will be remedied, but they're going to have to ramp up production pretty quickly in order to meet the needs domestically that China has as well.
Oh, right. So how quickly then do you think Sinopharm can actually enter that COVAX pipeline that we keep talking about?
Not fast enough, as far as we know. As you know, there's dreadful situations right now in India and Brazil, and that's where it's really needed right now. And India has the problem that they are one of the world's largest producers of vaccines, but they were exporting vaccines, and again, they failed to vaccinate their population.
Right. The big question that we've always had is why hasn't it been approved for so long? The Sinopharm vaccine is already being administered in more than 40 countries, only about 45 at last count. Presumably this approval will help boost confidence about its safety and efficacy?
I presume so, but remember, it's an emergency approval, and in fact, the data that we have in the West on this Sinopharm vaccine is limited. There have been a few hundred people in trials that have been published in the Lancet showing that it works. But it has never been tested, as far as I have seen any reports, in people over age 60. Now, in fact, most of the world's countries that need this are young. The average age of the population is sometimes under 14. So that shouldn't be a huge problem. But the safety has not been demonstrated in people over 60, although we think it's going to be similar for all of these vaccines. They'll have a similar profile.
Right. But at this point, all the vaccines that are available are still only under emergency use. Is that not right?
That is correct. I think that we're basically trying to fix the car in which we're driving at the same time, and that's the dilemma for public health and for immunology right now. We're confronted with a pandemic of huge proportions that we've never faced before. This past year has created a lot of conditions that no one ever anticipated, and so it's a real challenge to figure out the right strategies.
Right. And Devra, we are also expecting yet another decision on another Chinese-made vaccine, Sinovac. What are your thoughts on the chances of it getting a WHO approval also for emergency use?
Well, I think that it might be more problematic because, again, the data that have been made public suggest that its efficacy is just maybe over 50%. And so I'm not sure it's going to get the same endorsement at this time. But again, if there are different data, then that would, of course, change the view of the reviewing groups that are looking at this for emergency authorization.
And so, lastly, I just sort of want to get that sense, since we talked about emergency use, what needs to happen for any of these vaccines to get, I suppose, a full blanket approval?
Well, we have to have enough clinical trial data. And again, we're kind of in the midst of developing that in most circumstances. We will only know in retrospect what really worked and what didn't work. And that's an unavoidable consequence of this unprecedented situation which we find ourselves. We can't tell people, hey, come back in 5 years when I've completed my clinical trial and we'll figure out what to do. We've got to do the best thing possible at this time, and that's why I think the Sinovac may not get the same approval that Sinopharm did, because again, the data I've seen suggests that it is not quite as efficacious. However, all of them appear to protect against severe disease, and that's of course important because if you prevent severe disease, you prevent death.
Right. All right.